Hi dear students, hi and a very warm welcome to this DAMS Daily channel on YouTube, where I will talk to you about the strategy for the upcoming MCI screening exam, which is scheduled to happen in June 2021 this year. Now my 2 points into it at the outset is, and I want to let all the foreign medical graduates who are talking to me right now understand that last 1.5 year has probably been the toughest for the foreign medical graduates who are international students who are studying abroad, and when they come back to India they have to appear for an MCI screening exam. But last 1 year odd has been very tough for most of them, and a reason I'm saying this is because of the pandemic, international lockdowns, travel restrictions. Suddenly, what we have seen is that the students who are studying abroad had a lot of disruption in how they were studying in the last a year odd. But nevertheless, there are exams to be given, there are licensing exams to be passed, and we need to balance the what is happening in the world and in our own lives with the exams which are happening. And we require three components when we talk about the exam preparation. And it is my intent to talk about those components today in this session, because we are at a very critical point today, and a lot of students, a lot of foreign medical graduates actually send me messages to talk about this particular issue in a video, because I feel that this is a very critical point. This is a point where there are 3 months left. Okay, so the time left is enough kind of a time. It is not too less. So we are not at a situation where the time is up or you have lost all the time. It's not like there is 3 months left and you can actually do it. On the other hand, I also see that that it's like a middle of the ground. Like if I delay it further, if you delay the preparation or your starting of your exam prep further, the things might go wrong. Like it's not like it's a very critical zone. Like if you do some intervention at this critical zone, things will happen and you can actually pass the exam in flying colors. But if we let this zone go, going forward it will become more and more tough. So like this is the zone where we need to talk about three things. We need to talk about the mindset needed, the mindset that you need to get through this exam. We need to talk about some strategy. We need to talk about some academics. So what I'll try to do is I'll give you in a nutshell what is my viewpoint and how do I see people who have done well in the MCI screening in the past. How do I see what do I learn from the journeys of Damsonians in the past who have done and easily passed the MCI screening exam. And so let's look at them. First thing that I want you to know is I have seen that the students or the aspirants who pass MCI screening easily are the ones who have actually believed that they can do it easily. It's like paradoxical, but you have to understand what is happening is when you are a foreign medical graduate today, you are always in a zone which is you're split by two things. You're split by self-doubts and you're split by the fears. Now what is happening is around you there is always a fear with every 2 years there is an MCI screening exam that happens where there is a result which is less than 10%. Like if you look at a pattern in the last 10 years, I've always seen that every 2 years there is a one-off exam which will give real low scoring exam will happen. And what will happen is that will send like a current of fear into the future aspirants. And second is that we all have that self doubts, and these self doubts they get amplified with that poor result. That suppose you are a foreign graduate, you just started your medical course, and you meet say one of your seniors, or you get to know that one of your seniors has not passed this year, and all that creates that self doubt. Am I in the right place studying? Am I doing the right things? And so what is happening is in this self doubt and fears, all this is inducing an element of inaction, and it is very important to understand. Now, suppose the exam result is not coming good in the past for one of your seniors or one of your bad seniors, you need to be working harder. But actually what is happening is, because of that fear, you start, doing less and less, because you feel, oh my God, whatever I may do, nothing is going to work out, and you're not doing anything. And this creates a vicious cycle. Another thing that I've noticed is that, people who are able to come out of this, vicious cycle, that is what I said, that the key element here will be the mindset, which will form the basis of what I'm going to tell you later about the academics and the strategy. But the mindset is critical here. If you really believe that you can, it is possible. It is possible to do it. Okay, let me give you an example. I have seen on this very channel, if you look back, scroll back, you will find so many of the previous MCI screening past students whose interview I have taken on this very channel, and they have done very well even when they gave 3 months of time, 4 months of time. So it is possible. It is like you need to believe it. It's like, it's not like I need to believe it or somebody else. It is like you need to believe it, that it is possible, and then you need to put in work to make it happen. And then you could be one of those who would be giving an interview to this channel later on. But let us do a small exercise today. The exercise that I want you to do with me today is, I want you to say with me that I forgive myself for whatever I have not done in the past. So I want you to begin today by saying that you forgive yourself for whatever you have not done in the past. Okay? I want you to really speak it out with me. So once you say this with me, and if you are on the chat box, please write down this line for me in the live chat, so that I know that you have that. You have to close the circle first. Now what happens is, in this vicious cycle that is hitting us down sometimes, of self-doubt, fears, poor results, everything kind of inducing a paralysis onto us, which is not letting us work, we need to close that circle. But to close that circle, first of all, we need to forgive ourselves for whatever we have done in the past. Now what happens is, now whenever I'm in a zone of self-doubt, and plus my result in the past is not good, now what will happen is, suppose you were not studying for the last 2 years or 3 years, and now you started to study, all that regret of not studying earlier would kind of weigh down on you. You need to close that circle. And today is the time to close that circle. I'll again repeat that we are in that critical zone where you need to listen to me, because this is a critical zone where it is like a make or break zone. If we hit hard in this zone, we can make things happen. If we hit hard, we will be actually talking about your PG entrance in after 3 months, when you will have passed your MCI screening. We'll talk to you about how to go about becoming a specialist and super specialist. This is the zone where you can make it happen. And there is enough time. I want you to truly believe me. I have seen people do it. There is enough time to pass this exam. We need to close the past circles. We need to move forward with self-belief. We need to move forward with intent. Now, another thing I want you to know is that, once you are, into that mindset, once I have, put you into that frame which is required to be the winner in this exam, I want you to know the strategy. Now, when we talk about 3 months, we will not play the entire match at the same pace. It is just like cricket now. You will not play the entire 50 overs in the same fashion. You will build up the innings, and then you will hit the ball hard in the slog overs to make sure you maximize the score. Similarly, when we talk about MCI screening, you have 2 phases. You have a 2 months phase, a 1 month phase. Now that means you have 3 months left. I want you to forget about the final month right now. The reason I'm saying this is because final month is not for cooking new stuff. It is about consolidating. So I want you to be very clear. The final month in your preparation will be about revision of what you have done so far and tests. That is all you will do. That is all you will do in the final month. Mock test. So on the eMedicos app, we will conduct special mock test for you for MCI screening. So mock tests, revision of your own notes, that is all. And I also want you to visualize the final year right now, the final month right now, so that you are preparing yourself also. Now what is happening is, a lot of students today, when they are studying from a video based resource, they do not write anything down. because they feel that, okay, in the end I will listen to the videos again and again. But sometimes if you listen to the video again, it might not be possible to do that in the last 15-20 days, 1 month. So it's always a good idea to plan your 2 months with this concept in mind. So if you can plan your 2 months that, okay, whatever I will study in these 2 months, or whatever I have been studying in the last 2 months, has to be consolidated in the last 1 month. So you will immediately start making notes. It is always a common sense to understand that good students who pass easily are the ones who make their own notes and then they read these notes multiple times. That is a very important rule to be kept in your mind. So we will keep it in mind that the final month will be for revision. I will make notes here onwards so that I can maximize the effort, maximize the output in the final month. And second thing I want you to do is make notes in your own language. When you write it down your own self, it becomes more easy. So I have had students in the past who would make it write in the class as per their understanding, that okay, and even they would write down like how the teacher has made them understand this concept, so that when they look at their notes, it is very easy to come back to them. So final month should be for revision and tests. Whatever we need to do now is we are going to make our material ready for the final month. That should be your plan. So let's plan it further. And I want you to have a little background here when we are planning it, because I have seen in the past that that when a student is appearing for MCI screening exam, sometimes we come with a closed mindset that this is how the exam will feel like. And if you remember, in August 2020 in the MCI screening exam, we saw a big surprise. And coincidentally, the result also in that exam was less than 10% pass rate was there. So I just want you to have that background in your mind. Once you know what is happening globally and what is happening in the Indian medical education structure with the MCI being replaced by National Medical Commission, it will give you an idea on why and how your paper will feel like in future. Now, what is happening now is, with coming of National Medical Education, National Medical Commission, they have come up with a curriculum called as competency-based medical education curriculum. Now, what is happening with this curriculum is, instead of the routine rote learning, now the exam boards are gradually in India shifting towards horizontal and vertical integration. Now, when I convert the entire subjects into horizontal and vertical integration, I get into a subject like architecture and I create a system wise architecture. Let me explain to you. Now, suddenly the exam boards are thinking like this, that now there is nothing like anatomy, pathology, medicine in their mind. For them, there is a cardiac sciences module in their mind, which has cardiac anatomy, cardiac physiology, cardiac pathology, cardiac diseases. And so this was reflected last year in NEET PG as well. And this is one of our predictions for this year's NEET PG, that this year's in NEET PG, we will have more and more integrated questions. And the board that is conducting the exam for MCI screening is same as what is conducting, which is conducting the NEET PG, which is National Board of Examination. So all this in the backdrop is very important for you to understand. Otherwise, what will happen is you will have a frame of mind that MCI would be the one-liner and I need to mug up this. There are 2 guidebooks available, one X, one Y, I'll mug it up. You might end up getting surprised in the exam if you go with that kind of strategy. If I don't see what is happening around, and if I go like with my eyes closed into the battle, I increase the chances of losing many-fold. So my suggestion to you is just look at the way exam boards are evolving world over. You might have seen recently in America, they have now declared that in future USMLE step 1 will become only pass and fail. They've reduced the kind of importance of the basic sciences. They have increased the importance of the step 2 CK there also. We saw this happen in the August MCI screening as well, where there were a lot of clinical integrated questions. The number of long stem questions were lesser in the December paper, but in the August 2020, there were a lot of clinical integrated paper. So exam pattern is evolving. And it's actually, if we look at the buzzwords right now, there is a big buzzword happening here, is that even if you're asking basic sciences, it's a good idea to ask the clinically relevant basic sciences to the candidates, especially in a licensing exam. So that is where my feeling here is that, if you are rote learning one-liners, it might be a risky proposition right now, because and if you're only mugging up old papers of MCI thinking that they would be repeated in the paper, I think you're going in the wrong direction, because that methodology today is not working in any exam, because the exam pattern, the medical education framework in India is totally evolving. And this part of my video would even stand true when you listen to me in maybe 2 years later, 3 years later, because you will see the MCI screening exam itself will be replaced in future by next. So, and even the NEET PG will be changed to next, and there are so many ramifications of how the things are evolving in India as far as the medical exams and the postgraduate medical entrance exams are concerned. So once you see everything with the correct framework, you need to know that conceptual understanding of the most usual things becomes more important. Let me give you an idea. Like, now suppose you do not know what is the most common say cause, or you do not know the scientist or a year in which something was discovered. It is okay now if you see those questions in a previous MCI screening book. That is okay. Once upon a time they had those kind of questions in the paper, which is now no longer true. But there are things like emergencies, like suppose a patient comes to you with a road traffic accident followed by breathlessness, hypotension with a hyperresonant note on percussion, a mediastinal and tracheal shift to the other side. You're thinking of tension pneumothorax. What will you do? So the answer is you put a wide bore needle in the fifth intercostal space. Now what happens is the questions like this, where you have an emergency theme or a clinical integration into it, would remain relevant. So you would need to know the answers to the most usual things. Like, as far as I am concerned as a radiologist, I feel pneumothorax is very important, pulmonary embolism for you is very important, brain hemorrhage, extradural hematoma is very important. And you would definitely get a question out of these three things in your exam, like even if we are just having a casual talk, because there cannot be an exam where they don't ask these usual things, because they have to find out now what is the purpose of a licensing exam. Now in our medical education sector, there are two parts. There is a degree that you get from the university where you study, and then there is a license. And that is true for most of the countries. Wherever you go, even if you have acquired a degree abroad, you will have to appear for the licensing exam of that country to be able to practice medicine in that country. That licensing exam in India is, as of now, MCI screening, and in the near future it will be changed to next. So why do we have a MCI screening exam? Why do we have a licensing exam? To make sure that the candidate who is practicing medicine is not a threat to that patients, and is able to is competent enough to serve the patients. So so those kind of things which are of usual importance to a clinician at graduate level would remain more and more relevant. And I feel that is why the paper will feel more and more clinical to you in the coming paper. I felt even the December paper was far more balanced than if I look at 2019 or 2018 kind of MCI screening paper, the December 2020 paper was far more balanced and more focused on the usual things. So usual things which you also know deep in your heart, okay, these are the kind of things they will be asking. Emergencies, clinically relevant basic sciences, they would remain more and more relevant in the changing scenarios. And I also want to remind you that the exam that you are going to give is a threshold exam. This is not a competitive exam, so don't prepare for it as if you are preparing to beat others. Like, it is not between you and the students, other students appearing for the exam. It is a threshold exam. This is the exam where you need to pass the exam, and you pass when you score more than 50% in the paper. So there has to be a high yield approach to your preparation. Now suppose if it is a competitive exam, you need to do better than others. So every tiny bit becomes more and more important. But when you are preparing to pass a threshold exam, where passing is the most important thing that you want to achieve. But let me also tell you that there is value in scoring more in MCI screening, because that score is used later on as a tiebreaker in the NEET PG when you appear for PG entrance later on in India. But as of now, the most important outcome that you want out of the exam is passing. So when you are targeting passing, we need to make a strategy. And today I will give you an academic strategy which I feel would work in the current changing pattern, which will help us to see the way how we go about the exams. So these are the three trends that I've been talking about. One is the integrated pattern, second is the clinical vignette style, third is the image-based question. So we can already see these three things are the newish trend which we saw in the previous MCI screening exam. We saw it in the August MCI screening exam as well. We saw a lot of integration happening in the questions. I met a lot of candidates who came out of the August 2020 MCI screening and said, sir, after the exam I felt that anatomy question was also sounding like a clinical question. Integration. Integration means a clinical scenario asking you a basic sciences fact, which I've already explained to you. Long stem clinical vignettes is an important thing here, and image based questions are an important component of the paper right now, and they make things very easy. Now I'll give you my idea about all of them. So let us divide your subjects into clusters. I will now give you the cluster number 1 of your studies. You should study for your MCI screening in clusters. The first cluster should be medical specialties. In medical specialties, I will include the specialties which I will call them as allied branches, as well as one which can be integrated with medicine. So like for example, so if you are now studying for in your final 2 months phase, what I will advise you is when you are reading CNS in medicine, at the same time in your notes book, if you've already studied, if you are in the final phase, at the same time in your notebook, you should open the CNS section of the pharma, CNS section of the physiology, infections related to that system, and we can also integrate a bit about dermatology as a allied specialty. So what would happen is there is like a trio of subjects which is like the backbone of your medicine preparation, that is called as pathophysiopharma. So if you are able to do the medicine integrated with pathophysiopharma, your output will improve. So what I would want you to is divide your study into clusters, and when I am doing the preparation of one subject in this cluster, like suppose you are starting your medicine preparation, this is the zone in which you should also be planning to do pathology, pharmacology, physiology, microbiology, and dermatology as a allied science. Although the number of questions in MCI screening on dermatology is not too high, but they are very simple. If you do dermatology once, it becomes very high yield. And I always tell all my students that focus on your class notes and your DAMS lectures for these sections. Just listen to what the teacher is telling, and that is all you need to know. So I think, this gives you an idea on the first cluster. The second cluster is the surgical. Here what I would want you to do is, when you start your surgery, you also start, after that you start, radiology. It would make a lot more sense when you listen to the surgeon talking about the head injury and a radiologist showing you the extradural hematoma, this is the previous MCI question, or intestinal obstruction, and X-ray showing you intestinal obstruction, anatomy of a muscle and how it is inserted on the bone and how the fracture is, and orthopedics, it makes more sense. But again, in this cluster, I want you to understand that orthopedics contributes less questions in MCI screening than in the other exams. So you can actually think about more about the integrated aspect of all this, rather than going for a separate dedicated time on orthopedics. What you need to do is you need to focus on surgery, radiology, anatomy, orthopedics together, and you need to focus on medicine, pharmacology, pathology, physiology, microbiology together. Now what happens is this gives you 2 clusters, and you will find if you are good at these 2 clusters, you have actually already passed the exam. But the only challenge in these 2 clusters is these 2 clusters are broad and wide, and especially when you have already started preparation in your college years, sometimes you might have increased the bulk that you have with you so much that you might not be able to do the subjects in a concise manner. So I wanted to introduce to you the third cluster. If you understand this third cluster, you will actually win the game, because this is the cluster of magic, and I feel this is the cluster that most people are missing out. Obs and gynae, PSM, pediatrics. This cluster, if you're good at, you can actually, cover up a lot of lost ground that you might have created in medicine and surgery just because of vastness of the subjects. Now, can you imagine now that I have always analyzed and felt that these subjects, especially the obs and gynae and PSM, are contributing to questions in the exam, but the size of the subject is far smaller than the medicine and surgery books, which are far larger in size. So, these are like, now if you look at these three clusters in the correct sense, you will find that, okay, this is what I need to be doing. When I'm doing obs and gynae, I should continue with PSM also. I'll find a bit of overlap also in different programs, and I should also finish up pediatrics at the same time. Cluster number 4, I have kept these three subjects for you: ENT, ophthalm, forensic medicine. Small subjects, high yield. If you're able to do them, very direct questions in the exam, and they help you to get through the exam very easily. So what I feel is, if I now take you back, what I've done is I've given you 4 clusters. You have 2 months. So let's divide our remaining 2 months into 15 days each. In each 15 days, I will study one cluster. So you will spend your 15 days on medicine and allied and integrated specialties. Let me clarify what I mean. When you look at the MCI screening curriculum, you will find they will say medicine and allied fields. That would include things like dermatology, psychiatry, radiology. These are like allied fields. But they will also say, integrated. That would mean basic sciences questions which are asked in a clinical manner. So, like, we all understand this by now, that physiology is integrated with medicine, anatomy is integrated with surgery. And this is what we saw in the NEET PG last year. This is what we expect in the NEET PG last year. This is what we saw in the August 2020 MCI screening. We saw this in the December 2020 MCI screening integration. So how would you integrate is, you would be studying your subjects in clusters like this. You will give 15 days per cluster, 15 days for these medical specialties, 15 days for these surgical specialties, 15 days for these golden topics which are short but massive number of questions. You can actually get into 180, 200 plus score if you follow my strategy, and you give a good amount of time on this cluster. If you're able to do that, you have some time left in this cluster, you can fill in with biochemistry also in this cluster, so that you are more and more safe. I would actually add biochemistry into this cluster to make it more well-rounded and more safe. And then the final month will be for your ultimate revision. Okay, so we need to know how, because now you might say that you have been doing all this and still in the last 2 exams or 3 exams, you might say that, sir, I have not been able to pass the exam. Now we need to understand that whatever you may be studying has to reflect as a good score in your exam, and the exam is taken in a multiple choice kind of a format. Now it has been seen over the years in different formats in across the world. Now, what is this MCQ format? I'll try to give you a background here. This has been created to create an objective framework for testing the candidates. Now, for example, like, would you want to do a screening exam which is done in a viva voce kind of a manner? No, because there would be so much subjectivity and bias in the mind of different examiners. You don't want to be subjected to that kind of a scenario, and that is where objective multiple choice questions have always been selected in the licensing exam formats, be it a US medical licensing exam or India. But what happens is, some candidates I have seen who are good otherwise when I see them studying, but when I see their score, they are not able to pass that 150 mark barrier. And I think the missing link for them is the MCQ skill. I will now give you a small mantra here which will help you, and I'll give you some more tips on developing the MCQ skills. And I strongly recommend the DAMS question bank, the DQB, for the candidates who are appearing for MCQ this year or in future, to make a habit of doing 50 or 100 MCQs from DQB every day. Every day you should be doing 50 MCQs. Because if you don't get that MCQ mindset, you are putting yourself in unnecessary trouble. What I want you to do is, I want you to look at every question in DQB whenever you are appearing for the test or the question or a Q bank. whenever you look at a question, you are going to now think what is the answer. Now, you might say, sir, if I don't know, how can I think? What will you do on the day of the exam? You will think. Now, so the key is, I want you to create in your mind, I want to just fix some screws which will say that I will not give up on any question. Okay, I will try to find the answer. Now, if you change your mindset from, that I don't know to I have the answer inside me, you will start seeing it. I'll explain it to you. It is a difficult concept. But what I've seen is all the students who are high achievers in the MCQ format are the people who do not give up on the question and who try to find the answer somehow. Like I'll give you an example here, and that was true even for your PMT exam when you were appearing for your PMT days. It's like many times the answer is not directly known to you, but when you work harder, when you spend more ATP, you try to rule out answers, you can reach to the answer clearly. So you need to do some hard work there. But to do that, you need to start with that belief that you can. Every question, the answer is possible to be solved by your class notes, what you've done in the past. And I tell this to all the Damsonians that, you've studied with the best of the best faculty, you have listened to all the best of the best lectures, you have it with you. Now what you need to do is, you need to apply it. But when you are applying it, you need to bet on yourself that I can solve it. And then look at the question carefully, look at the choices carefully, try to enter the question somewhere, try to rule out, reach to the answer. There is no negative marking in MCI screening exam. So that means if I have a good MCQ skill, I can actually inch myself out of that less than 150 domain to more than the happy zone of more than 150. You can actually get out of it. But you need to bet yourself. You need to tell that, okay, I will try to solve questions. Now I want you to promise me one thing. That promise is, in DQB, in the coming 3 months, every day you will do at least 100 MCQs before you sleep. Okay, promise me that you will do 100 MCQs because you have 3 months to go for your exam. You will spend at least 100 MCQ time every day. This will strengthen your MCQ muscle in your brain, because what will happen is, you have to break those barriers of fear, in imposter syndrome, whatever has, you have accumulated so much around your mind that you are unable to put that killer instinct onto the exam. You need to bring that back. You need to bring that mojo back into the exam. You need to get back into the same kind of passion that you had for MCQs during your PMT days or your school days. You have to push it hard. To do that, we need to get into a habit. Successful people have good habits. People who are successful in MCQ exams have a good habit of daily doing some MCQs. So I am giving you a good important mantra today: 100 DQB MCQs every day. 100 DQB MCQs every day. And practicing the paper is the key. So I will also now give you the insight into the, how the system would work is, in the coming 2 months, I would want you to focus more on the things like DAMS question bank, DQB, on the test and discussion course, on the high yield revision course that we have. But in the final month, I will ask you to shift more towards mock test and revising. So the practice will be different in the 2 phases. The first phase will require a little bit more longer work. In the final phase will require more consolidation. That is the key. You will also gradually need to know that the paper will have visual questions, and these are high scoring questions, because once you see an image, sometimes it becomes so easy to solve the question if you are good at the image. And many students, what they do a mistake is, they don't read a subject like radiology or dermatology, and what happens is, you find that there are like around 10-15 images of radiology in the clinical section integrated with medicine. But they were so easy to be done if you had known the image. So do not skip out on subject like radiology, because it is or any subject where image based questions can be formed, because image based questions are very easy to be done and they can be very easily cracked, and often image based questions are more commonly asked in the clinical sciences paper of the MCI screening, not in the basic sciences. But it is again a very evolving and a very changing pattern in this exam. So I would not want you to bet on anything, but do not miss out on the clinical imagery. anytime you are doing a image based question, okay, image based question, we need to know that we need to look at the choices first, then look at the image to, you know, limit our thinking process to those choices. Sometimes I see students and candidates, they are looking at an image and endlessly wondering what this image could be. That is not the pattern of your exam. You will have 4 choices. So you see the choices, कि भाई which of the choices do I need to consider in this image based question. Please do that. You will find yourself getting better and better in the image based questions. Similarly, we need to develop an approach to the long stem questions. In the long stem questions, always remember this line, the last line of the question is most relevant. So always look at the last line of the question and the choices before you read the long stem of the question. Last line of the question, choices, will give you an insight of what is to be asked, what are your choices, and why do you need to read the question, because if you don't know the why, you will be wasting a lot of time, and time management will, you know, again reduce your chances of passing. We need to manage the game in a smart manner so that we pass the exam. The preferred outcome after the 3 months is that you should pass the exam in flying colors. You know it already. There will be some long stem questions, there will be some image based questions, there will be integration in the paper. The usual topics will have more weightage. One liners will not be preferred in this kind of exam this year. So if you are starting now, if you're starting your preparation for MCI screening now, you know, a lot of students have asked me that what DAM scores can, you know, work out for me if I am planning to start now and I want to study in 3 months. So I would recommend a course which is a high yield recorded video course that we have. Now, if you go to the eMedicos app, you will find a course saying pre-recorded high yield video recorded course. This is like every subject, the most usual topics have been taught in a detailed manner. Like what we have done is, this is a very unique course where we have cut down on the unusual things, kept it only to the most high yield things, but we have gone into the depth of those topics. I'll explain it to you. That what happens is, usually when people make a high yield course, they cut down on substance. We have not cut down on any substance here. We have not even cut down on depth. We have only cut down on the useless things or the less often asked things and kept it to the most high yield possible stuff, and we have gone into the depth of those questions and those topics. So I think this is a course which can be done in 2 months and revised in 1 month. But another thing that comes to my mind, and a lot of people have asked me, sir, I've already started it, I've already, you know, following a DAMS course, and I am now seeking extra edge. Now what should I do? So what we have now launched is 18th of March, we are starting a test and discussion course. Yes, we are starting a live test and discussion course on eMedicos app. This will be a live 2-way interactive course. Now, even if you have started your preparation on your self-study mode, or you have been preparing earlier but you don't feel confident, I think this is a solution that we have created for you. I feel that you need to do MCQs. So, but sometimes, you know, whatever I may say and whatever others might advise you, you might not be doing enough of it. So this is a course where you will have tests. So there is a scheduled test and you have to appear for that test, followed by a live interaction with the teacher. This live interaction is different from a pre-recorded course. Here, a teacher is actually sitting live and you're doing a 2-way interaction with the teacher, and you can ask your doubts and clarify. So this course has 3 purposes. It gives you a schedule to follow. It gives you a test to do your MCQ practice and hone your MCQ skills and your test skills. And it also gives you a landmark for finishing your revision at that time, and a landmark to ask your doubts to the teacher and clarify things, so that when you appear for the exam, you don't repeat those mistakes. This course is starting on 18th March. It is available on the eMedicos app for subscription, and this is how you will have a subject-wise schedule laid down. When you click on any of those buttons, you can see the date on which it is scheduled, and you can make your timetable synchronous with this course, and you can fine-tune your revision with this special MCI screening app live test and discussion available on the DAMS eMedicos platform right now. And I want you to also start imagining MCI screening as a part of your journey that you are creating, a story that you're creating in your medical career. Don't look at it as a destination. Now, when you start looking at MCI screening as a destination, you build a lot of pressure on yourself, But when you start looking at it as one of the landmarks that will happen. Now let me take you back to your school times when you started to visualize medical career for the first time. And that is, you had a very broad picture that, one day I will become a very famous a cardiac surgeon, a neurosurgeon, or a super specialist. Now what happens is, but in between you lose that track somewhere and you start thinking your destination is MCI screening. And that is where the entire pressure becomes, and that is where the entire stress creates. But if I can, retune my mindset that, okay, medical career is not a destination oriented career, it is a journey kind of a career. It is, imagine swimming in an ocean where swimming itself is the, thing that you're doing, and swimming itself is giving you pleasure. It is not a race where when you reach the destination, then only you get pleasure. The journey itself is the pleasurable part. So when you start visualizing medical career as a journey, and MCI screening as one of the landmarks that you will pass in that journey, you will start feeling more and more better about it, and you will start performing better, more and more better. And because putting too much stress onto one exam in your mind, it becomes counterproductive. A little stress is good, but too much stress becomes counterproductive. So don't get overwhelmed by the word MCI screening. Don't get overwhelmed by any senior who has not gotten a good result in the past. Forgive yourself for any past mistake and focus on you making things happen. I am telling you, you have the possibility to pass this exam in the coming 3 months with a dedicated effort. Put more effort than what you were doing in the past. Push yourself out of your comfort zone. Believe that you were made for a grand medical career. Think about this exam as just a stepping stone in that journey that you are creating. Make it happen. I wish you all the best. God bless you.